Alright, listen, if hypersensitivity reactions feel confusing, like type 1, 2, 3, 4 just blend together, this video is going to fix that permanently. By the end of this, you won't be memorizing charts. You'll actually understand what's happening immunologically, and that's what USMLE Step 1 tests. So imagine I'm sitting next to you in the library explaining this the night before your exam. Let's do this. Big picture, first hypersensitivity reactions are basically an overreaction of the immune system that ends up damaging your own tissues. There are 4 types, but instead of memorizing them randomly, think of them as 4 different ways the immune system can cause damage. Type 1, immediate, IgE-mediated. This is the dramatic one. This is your anaphylaxis. Food allergy, allergic asthma, allergic rhinitis. Here's what's happening. First exposure, allergen enters. Your body says, this is dangerous. Th2 cells get activated. They release IL-4 and IL-5. B cells switch to producing IgE. That IgE binds to mast cells. Now you're sensitized. Second exposure, allergen comes back. Crosslinks, IgE. Boom. Mast cells explode with histamine, leukotrienes, prostaglandins. And what does histamine do? Vasodilation, increased vascular permeability, bronchoconstriction. That's why you see hypotension, wheezing, hives, swelling. USMLE loves asking, what's elevated? Answer, tryptase and IgE treatment, epinephrine. Not antihistamines first. Epinephrine. Alpha 1 leads to vasoconstriction, beta 2 leads to bronchodilation. That's type 1, fast. IgE, mast cells. Type 2, antibody against cells. Now we move to type 2. This one is IgG or IgM. But instead of floating around, these antibodies bind directly to cells. 3 things can happen. 1. Complement activation leads to cell lysis. 2. Opsonization leads to phagocytosis. 3. Antibody-dependent cellular cytotoxicity. Classic examples: autoimmune hemolytic anemia, good pasture syndrome, myasthenia, gravis Graves' disease. Now here's the high yield twist. Not all type 2 destroy cells. Some just change how the receptor functions. In myasthenia gravis, antibodies block acetylcholine receptor. In Graves, antibodies stimulate TSH receptor. That's extremely testable. And immunofluorescence, linear pattern. That's how you differentiate it from type 3, type 3, immune complex deposition. This is where students get confused. So think of it like this. Instead of antibodies attacking cells, they form antigen-antibody complexes in circulation. These immune complexes float around, then deposit in kidneys, joints, skin, blood vessels. Once deposited, they activate complement. Neutrophils rush in, inflammation happens, tissue damage occurs. Classic diseases: systemic lupus, erythematosus, post-strep glomerulonephritis, serum sickness, polyarteritis nodosa. Now here's the step 1 clue: low complement levels. Why? Because complement is being used up. And immunofluorescence pattern, granular. If you see granular, think type 3. Or type 4, delayed T-cell mediated. This one has no antibodies. 0. It's all T cells. That's why it's delayed. It takes 48 to 72 hours. Mechanism: antigen presented to T cell activation to cytokines released to macrophages, recruited to tissue damage. Examples: contact dermatitis TB skin test. Type 1 diabetes multiple sclerosis granulomas. That's type 4, because IFN gamma activates macrophages. No antibodies involved. If you see delayed reaction after 2 days, think type 4. Start the high yield comparison. If the question says IgE plus mast cells leads to type 1, IgG against basement membrane plus linear, IF leads to type 2, immune complex plus low complement plus granular, IF leads to type 3, delayed reaction plus T cells leads to type 4. That's literally how step 1 wants you to think. Board style thinking example. Patient has hematuria, hemoptysis, linear immunofluorescence. That's good pasture. Type 2, if instead they said rash, joint pain, low complement granular IF, that's lupus. Type 3, see how it's pattern recognition? Final rapid review. Exam mode. Type 1 to IgE to mast cells to immediate. Type 2 to IgG/IgM versus cells to linear IF. Type 3 to immune complexes to low complement to granular. IF. Type 4 to T cells to delayed 48 to 72 hours. If you understand the mechanism, you don't need to memorize randomly. If this helped you actually understand hypersensitivity instead of memorizing a table, drop a like so more stressed med students see this. Next video, I'm thinking of connecting this to renal pathology because that's where USMLE integrates everything. And remember, don't just read immunology, teach it. That's how you make it stick. I'll see you in the next one.